Welcome to this section of the cardiovascular system, putting it all together. In the first section, we discuss normal sinus rhythm and the normal electrical system of the heart. In this section, we're going to discuss the atrial rhythms. So first, let's review. The normal heart rhythm begins in the SA node, travels to the AV node, next to the bundle of His and then the Purkinje fibers. The result of the normal electrical conduction of the heart is a normal sinus rhythm. The rhythm is regular with a rate normally 60 to 100 beats per minute. The QRS duration is normal and there is a P wave prior to every QRS complex. Normally, the four chambers of the heart, 2 atria and 2 ventricles, contract in a very organized way so the heart can pump all the blood the body needs without working too hard. The electrical impulse that signals your heart to contract begins in the SA node. This node is your heart's natural pacemaker. The signal leaves the SA node, travels through the 2 upper chambers of the heart, then the signal passes through the AV node and finally through the lower chambers or ventricles. In atrial fibrillation, the electrical impulse of the heart is not regular. The atria contract very quickly and not in a regular pattern. This makes the ventricles beat abnormally, leading to an irregular and usually fast pulse. As a result, the heart cannot pump as much blood as the body needs. In this category called atrial arrhythmias, the rhythm is generated from above the ventricles, making the QRS complex appear normal, 0.6 to 0.1 seconds. These rhythms are part of a group of rhythms called supraventricular rhythms. These rhythms are triggered by an impulse or irritable focus occurring in the atria. This means the atria are sending out erratic impulses that do not always make it to the ventricle. The atrial rhythms include premature atrial contractions, atrial fibrillation, and atrial flutter. With premature atrial contractions, the pacemaker cells are firing from somewhere within the atria and occur before the next expected beat should occur, as seen here. The rate is usually that of the underlying rhythm, in this case a sinus rhythm. The pacemaker site comes from somewhere within the atrium but outside the SA node. PACs occur as single ectopic beats or can be from multiple sites or called multifocal. PACs can occur in healthy hearts during periods of stress, fatigue, or with increased use of alcohol, caffeine, or tobacco. PACs do not significantly affect the cardiac output and usually do not require treatment, but they may be a warning sign of another arrhythmia. Atrial fibrillation is a rhythm that arises from multiple foci in the atria. It is characterized by rapid, erratic atrial activity called F waves and is irregular with its ventricular response, meaning it is an irregular heart rhythm. There are no P waves seen, just a wavy baseline. The atrial rate is